Good afternoon, everybody. I am Dr. S. Ramakrishnan. I'm a senior rheumatologist attached to Apollo Hospital for the last 26 years. My experience in rheumatology spans about 35 years. Today I'm speaking to you about arthritis, frequently asked questions. The questions which are frequently asked by patients or the public. The first question you could ask me is, what is arthritis? And arthritis means that any person develops pain in the joint or in structures which surround the joint with or without inflammation, swelling of the joint, tenderness in the joint, and he has got difficulty in moving the joint. If arthritis is not treated properly at the right point of time, these people can go in for deformities. Some people can ask me a question, what is the difference between arthritis and rheumatism? Rheumatism is a term which is used in the United Kingdom, whereas arthritis is a term which is used in America. But one important point is, if it comes to arthritis, it is mainly focused to the joint, but rheumatism refers to the joint as well as the structures which surround the joint. The next question you can ask me, is arthritis common in India? Yes, arthritis is definitely common in India. You could say, in fact, like diabetes or blood pressure. Is there any specific age in which arthritis should occur? There is no specific age in which arthritis should occur. It can occur in children, it can occur in the younger age group, it can occur in the middle-aged, and it can occur in the elderly. But very common, it is seen in the middle-aged and the elderly age group. Now the next question anybody can ask me is arthritis more common in women or men? God has not spared any sex from getting arthritis. It is common both in men as well as women. Certain arthritis is common more in men, and certain arthritis is more common in women. People come and ask me, Doctor, I have arthritis. Can you kindly tell me the cause for my arthritis? There are various causes for developing arthritis. The various causes are, one, it can be infection. Example, diabetic people, when they have an acutely swollen joint, it can be due to infection because diabetic people are more prone to infection. So that is called septic arthritis. So people usually present with severe fever with rigor and they have a painful swollen single joint. This is an emergency for which you have to seek medical attention. The second important cause for arthritis is what we call autoimmune disease. What do you mean by auto? Auto means self. Immune means against the own self. It means we have a defense system in the body. The important function of the defense system in the body is to fight infection. If suppose I develop corona infection today, my defense system in the body will fight the COVID virus, kill the COVID virus, and I will not get any corona disease. But basically what happens in arthritis, like rheumatoid, the body's immune system or defense system recognizes its own joint as an enemy and starts fighting with it. There is a big civil war going within the joint and the body, and the joint gets inflamed and the joint gets swollen. A classical example of this autoimmune arthritis is rheumatoid arthritis. There are certain arthritic conditions in which the uric acid can go up. This uric acid is a terrorist when it gets into the joint. When the blood uric acid goes beyond 7 milligrams, it can go and get deposited in the joint and it can precipitate arthritis. This is called gouty arthritis. The last important cause for arthritis is degenerative, wear and tear. Like how as we grow old, you can become bald like me. What happens is, if you take the knee joint, and these are the two bones which form the knee joint, on the surface of the leg, we have what is called a cartilage. The cartilage will act as a shock absorber between the knee joint so that you can jump from the 20th floor if you don't like, or you can push your wife if you don't want her. But still she will not get injured in the knee because the shock absorber effect in the knee joint will prevent developing her injury. But doesn't mean that you have to go and push your wife out and see whether she'll get injured or not. If you do that, please don't hold me responsible for that. Now what happens as the age goes by, this cartilage gets worn out, with the result ultimately these two bones get friction up between them and they develop pain in the joint. A classical example is, you would have seen your parents or your grandparents at home. They develop pain in the knee joint with difficulty in climbing up stairs, descending downstairs, standing up from the squatting posture, and in India they'll be having difficulty in using the Indian toilet. So this is called degenerative arthritis. Now you can ask me a question. Dr. Ramakrishnan, which is the most common type of arthritis which you see in India? The commonest one is degenerative arthritis, what we call as osteoarthritis. So, which is the next type of arthritis which you see? That condition is called rheumatoid arthritis, and I would definitely love to address rheumatoid arthritis today for the fact that it's quite a common problem and we have to know what is rheumatoid arthritis. How do patients with rheumatoid present to the doctor? They complain of pain in the joint, swelling in the smaller joints of the fingers, the toes, the knees, the elbows, and the ankles. They'll have severe early morning stiffness. It's more common in women. So if the wife has got rheumatoid arthritis, her hands will be very, very stiff in the morning and she would not be able to box the husband. Rheumatoid arthritis is, as I told you, an autoimmune disease in which the body's defense system starts fighting against the joint, thinking that it is an enemy. Rheumatoid arthritis is most common in women in the age group of 20 to 45 years. So it affects them at the prime of their life, when life is very, very important to them. Does rheumatoid arthritis affect the elderly? Yes. Rheumatoid arthritis can happen even in the elderly. Can it affect males? It can also affect the males, but it is predominantly a female preponderant disease. A lady with rheumatoid can ask me, why do women develop rheumatoid arthritis more than men? It is because of the female hormones which are responsible for triggering the diffuse system to go and fight against the joint. That is why, because of the female hormones, rheumatoid arthritis is most common in women in compared with men. Do I see rheumatoid arthritis in India? I definitely see a lot of rheumatoid arthritis in India. Is it increasing in India? It's not increasing, but the awareness is increasing because of all this patient education programs, and people become aware to a greater extent about the existence of rheumatoid arthritis. I will call affectionately rheumatoid arthritis as RA. We'll take that word. RA means rheumatoid arthritis. Now, the patient will come to me when he has a complaint of rheumatoid arthritis with pain in the joints, stiffness in the joints, warmth in the joints, severe early morning stiffness with inability to move the fingers and the wrist. When I examine him clinically, he will have tenderness in the joint with warmth in the joint, and I will find difficulty in moving his fingers. And when I move his fingers will be very, very painful. Even to touch the joint, it will be very, very warm and hot. So this is called rheumatoid arthritis. You can ask me a question. Dr. Ramakrishnan, you have made a diagnosis of rheumatoid arthritis in me. How can you establish a diagnosis of rheumatoid arthritis? We do a blood test in you. The test is called rheumatoid factor, which is done in all laboratories throughout the country, and the rheumatoid factor will be positive in patients with rheumatoid arthritis. You can ask me a question, because some people have asked me this question when they have rheumatoid arthritis. Doctor, I have rheumatoid arthritis, but my rheumatoid factor is negative. That means I don't have rheumatoid arthritis. It's not like that. 80% of patients with rheumatoid arthritis are rheumatoid factor positive, and 20% of them are rheumatoid factor negative. So to just brush up, if you had gone to sleep, including I have perfected the art of sleeping while talking. So at the end, at 4 o'clock when I end the lecture, I request one of you to kindly wake me up at the end of my lecture. Number one, arthritis means pain in the joint. It means swelling in the joint. It means warmth in the joint with or without difficulty in joint movement. The difference between arthritis and rheumatism: arthritis is confined to the joint and the structures surrounding the joint. Rheumatism can also affect the muscles and the other areas which are in the vicinity of the joint. Is arthritis seen in India? Yes, it is definitely seen. What are the causes of arthritis? One, it can be autoimmune, with the body's defense system fighting the joint. It can be due to metabolic cause like diabetes, where you have in gout, where you have elevated serum uric acid. It can be degenerative, like what we call osteoarthritis, which is a wear and tear of the joint. And it can be due to infection, what we call a septic arthritis, seen in the diabetic. So what is rheumatoid arthritis? Inflammation of the smaller joints of the hands with swelling and inability to move the fingers and the toes and the ankles and the knees. Rheumatoid arthritis is more common in women than men. Why more common in women? Because of the female hormonal constitution. Which age group? In the age group of 20 to 45 years. What test do you do to say rheumatoid arthritis? You will do the rheumatoid factor. It is not necessary for the rheumatoid factor to be positive in all patients with rheumatoid arthritis for me to make a diagnosis of rheumatoid, because the diagnosis of rheumatoid arthritis is more a clinical diagnosis than a laboratory diagnosis. One important point which I would like to drive home the point here is, whenever somebody has got an rheumatoid arthritis like presentation, you should always find out from your family whether they had any problem called psoriasis in the skin, which will be sort of rashes associated with excessive dandruff on the scalp, which I was had, not my scalp, which is totally bald. Actually, I would rather say baldness is a false sign of wisdom. So you should also always find out whether your family had got any history of psoriasis, skin lesions in the scalp. And you also should tell the doctor, I have dandruff, kindly cleanly examine me please, to exclude the possibility whether I have psoriasis or not.